Hello, doctors, students, and friends of homeopathy. Today, the 1025th uninterrupted webinar of Ifph is about to begin, the international session, the English session. And today's speaker is Dr. Deepthi Krishnamurty, Assistant Professor, Department of Obstetrics and Gynecology, Sri Veerabhadraswar Homeopathic Medical College and Hospital, Bidar, Karnataka. Dr. Deepthi Krishnamurty is practicing in North Karnataka since 13 years. She is an expert in treating various clinical conditions like thyroid disorders, gynecological diseases, and infertility. She has presented various papers in various platforms like Karnataka Qualified Homeopathic Doctors Association, etc. And the subject for today's international session of Ifph is PCOD case treated with homeopathy. Let me welcome Dr. Deepthi Krishnamurty, and I welcome you all for the session. Dr. Deepthi, it's your time.
Namaste, all of you. I am Dr. Deepthi Krishnamurty. I'll start the session, sir, directly.
Yeah, you can.
Okay, sir. So today we are discussing about polycystic ovarian disease, a case cured by homeopathy. Just to brush up what we know about polycystic ovaries. Polycystic ovarian syndrome is a common endocrinopathy typified by oligoovulation. See, we have to understand this. It's actually essential to understand because oligoovulation or anovulation. This is the most important thing because that is why most of the people with PCOD end up in infertility. Okay, oligoovulation, signs of androgen excess, and multiple small ovarian cysts. These signs and symptoms vary widely between women and within individuals over time. It is the most common endocrine disorder of reproductive age nowadays, as we have seen. It is affecting even small girls, just who have just attained menarche or maybe 1 or 2 years after menarche. Teenagers are being affected very badly with PCOD and PCOS. PCOD is a precursor of PCOS. It is before becoming a syndrome. It is just that the ovaries are filled with cysts. PCOS is a triad of symptoms where there is cysts in the ovaries with androgen excess and also insulin resistance, and there are other effects like hirsutism and cafe au lait spots and all those. So PCOD is a precursor of PCOS, and it is characterized by clinical picture of irregular menses or prolonged or absence of menstrual cycles. It may be ranging between 45 to 60 days, followed by profound and prolonged endometrial bleeding. That is, the girl or the woman, female, will not get periods, but if she gets her period, it will not stop. The bleeding will not stop. That is what I meant to say. So, treatment of PCOD with classical homeopathy brings about remarkable changes in the ovaries by regularizing the menstrual cycle. See, basically, ovary is a reserve of follicles. There are all types of follicles: primordial, primary, then mature, dominant, Graafian, and corpus luteum, corpus albicans, and all those. But what happens in PCOD is because of hormonal imbalance, there are follicles which have become cysts. That is water filled. What do you say? But it is like balloon like things in the ovary. Okay, that is what is the major problem. This is causing imbalance in the menstrual cycles. So with treatment, with homeopathic treatment, these follicles start reducing size and volume. That is interconnected. The menstrual cycles appear regularly. That is, they get normalized and regularized. That is once in 28 to 32 days for 4 to 5 days. It gets regularized. That way, hormones are balanced, and the cysts, what we say, will reduce in size. That is what I meant. So here is a case of PCOD which is cured with homeopathy. And actually, she had landed in infertility because of PCOD. She was not able to conceive. Okay, it was just to brush up. It was the PCOS was originally described by Steen and Leventhal. That is why it is also called Steen-Leventhal syndrome, manifested by amenorrhea, hirsutism, and obesity. Associated with enlarged polycystic ovaries, it is prevalent in young girls of reproductive age. Almost 20 to 30% of patients are young girls. The underlying cause of PCOS is unknown. However, a genetic basis that is both multifactorial and polygenic is suspected, as there is a well-documented aggregation of syndromes in the family. PCOD is genetic most of the times. That is, mother, sister, or maternal or paternal aunts, they have, that is given to the younger generation also. Specifically, an increased prevalence is noted between affected individuals and their sisters and mothers. That is what I told. Insulin resistance has been associated with an increase in several disorders, including type 2 diabetes, hypertension, dyslipidemia, and cardiovascular disease. Therefore, PCOS is not simply a disorder of short-term consequence, such as irregular periods and hirsutism, but it is also one of the potential long-term health consequences. Basically, it is a lifestyle disorder, PCOD. So to know the pathophysiology, to understand, anovulation leads to inappropriate GnRH secretion from the hypothalamus. Altered GnRH will cause increased LH when compared to FSH. This leads to, and also from other side, there is insulin resistance, which leads to compensatory hyperinsulinemia. Increased insulin. These two together, what they do, they cause androgen production by ovarian theca cells, which are increased. Actually, androgens are only produced and they are aromatized, but here there is excess androgen production, which affects the ovaries. Affected ovaries secrete elevated levels of testosterone and androstenedione. This increased estrone levels through peripheral conversion of androgen to estrogen levels by aromatase leads to irregular menstrual cycles. This is the pathophysiology of PCOD. As discussed earlier, PCOD, the clinical features include menstrual irregularities, prolonged endometrial bleeding, weight gain, infertility, and manifestations of androgen excess like growth of facial hair, body hair, and loss of scalp hair. This is, and also unhealthy lifestyle habits like lack of physical activity, unhealthy food habits, lack of sleep, and abuse of electronic gadgets can lead to lifestyle disorders, and PCOD is one among them. Therefore, lifestyle management along with homeopathic treatment can lead to good results in PCOD. This is my personal experience clinically, that use of gadgets, because we are all today we are all servants of gadgets, like it may be mobile, laptops, increased use of all these because of radiation and also because of sedentary lifestyle. We sit at a single place when we are using all these devices. All this is causing lifestyle disorders. PCOD was one among them. Homeopathy offers beneficial treatment options, as homeopathic medicines stimulate the body to secrete hormones in a balance and thereby regularize the menstrual cycles. Once the cycles are regular, health is brought back to order, preventing other consequences like PCOS, type 2 diabetes, hypertension, and so on. Homeopathy is practiced based on principles that are parallel to nature and holistic in approach. The patient is studied thoroughly on physical, mental, and psychological planes, which is helpful in treating the patient individually in a customized way suitable to the patient. Here we discuss a case of classical PCOD, which shows the effectiveness of classical homeopathic treatment. Sonography reports are attached for evidence. So now we'll discuss the case. A young lady, 24-year-old, came to OPD on the so-and-so date in 2021 with presenting complaints of irregular menses in the last 1 year. She attained menarche at the age of 14 years, history of irregular menses on and off since menarche. Menstrual cycles once in 45 to 50 days, slow, moderate, menses painful occasionally. She is married for 2 years and wants to conceive. This is what was the LMP noted. 2nd November 2021. Sonography dated 30/11/21 showed multiple small 2 to 5 centimeters well-defined thin wall cysts in the right ovary, likely ovarian cystic disease. She also complained of repeated colds once in 2 or 3 months in the last 2 years. Generally, she was thirsty, desired sweets, thermally chilly, and had constipation. Mind symptoms included fear of dark, fear of being alone, fear of dogs, and fear of dead bodies. So this was the repertorial totality considered using synthesis repertory 9.0. Mind, fear of dark 3+, fear of being alone 2+, dogs, fear of dogs 2+, fear corpses, fear of 1+, thirst 2+, sweet desire 2+, constipation 2+, menses irregular 1+, menses late 2 1+, and genitalia, tumors, ovaries, cysts 1+. So this was the repertory sheet. As we can see, the stramonium is one among the top 10 remedies. See, you can see it is 7th one. Most of the mental and physical general symptoms are covered by stramonium. Hence, stramonium was prescribed in LM potency twice a day for 2 days. See, Materia Medica of stramonium by various eminent authors. I want to discuss this here. Dreads darkness and horror of glistening objects. Great thirst but dreads water. Gusni says, cannot walk or keep on the feet in a darkened room, will fall. Nash writes, wants light and company, fear to be alone. Clark, the patients can't bear solitude or darkness. If they are left alone in a dark room, the mental affections are very much aggravated. Professor George Utulkas writes, extreme fear of dark, they need light on all nights. Unusual fears such as fears of cemeteries, fears of tunnels or closed places, fear of dogs. Particular symptoms will be triggered at night in the dark. There is a definite aggravation from darkness. Emil Taylor's black letter symptom says, fear of being in dark and less of being alone in the evening after sunset. Mania for light and company, cannot bear to be alone. So this is the follow-up details. She came on 21st, she came on in December. So this is, she had her periods on, where was that? On 2nd November. She came on 29th December. She had her periods on 2nd November. After stramonium, she had periods on 8th January. That is almost after 2 months. She had periods almost after 2 months. Again, I had given her stramonium 0/1 for 2 times a day for 2 days. Again, next, no menses. Even on 14th, she did not have menses. Again, stramonium was given. She had, after stramonium, she had menses on 25th. I had given her placebo. In April, she did not have menses. I asked her to check UPT and it was positive. Okay. She was advised to consult the obstetrician for antenatal care. So the above discussed case had cyst in the right ovary before treatment with classical homeopathy. As a result, the patient was unable to conceive due to irregular menstrual cycles. Here we have to remember that in PCOD, most of the times there are anovulatory cycles. After treatment with classical homeopathy for 3 months, the menstrual cycles were regularized and she conceived naturally, which is confirmed by the sonographic reports attached below. You can see, I have written the details of the report. Suggestive of multiple small, well-defined thin wall cysts in the right ovary in November, before she came to me. As you can see the date, 20 November 21. So, next, the date is 14/4, April. See, you can see features are suggestive of single live intrauterine gestation of about 6 weeks, 1 day of gestational age. But both ovaries appear normal. See, I have marked here, you can see both ovaries appear normal in size and echo texture. So, This is the birth certificate of the child, which was born on 29th November 2022. She conceived in March. She delivered in November. Okay, so rubrics from various repertories considered for PCOD. Genitalia female, tumors, ovaries, cysts. Genitalia female, menses irregular. This is by Kent. Kent's Materia Medica gives the following rubrics, which we can use for reference in our clinical practice. Genitalia female, menses irregular late. Genitalia female, metrorrhagia. Genitalia female, menses copious. So from Oscar Boric, that is the repertory by Oscar Boric. Materia Medica by William Boric, repertory by Oscar Boric, pocket manual. Female sexual system, menstruation protracted. Protracted is prolonged. Female sexual system, menstruation, scanty flow. As I told in the beginning, there may be scanty flow. Later, or sometimes there is no flow at all. Later, once the flow starts, it may get prolonged. Female sexual system, menstruation suppressed with ovaritis. Female sexual system, cysts, dropsy in the female sexual system. So these are the rubrics which we can consider in the Oscar Boric repertory. So uterine therapeutics by Henry Minton is actually a gem in treating gynecological cases. It is very handy and it gives both Materia Medica and repertory. Uterine therapeutics by Henry Minton. So the rubrics of uterine therapeutics are menstruation, time and quantity of menstrual discharge, irregular. Menstruation, time and quantity of menstrual discharge, profuse, menorrhagia. Menstruation, time and quantity of menstrual discharge, profuse and protracted. Menstruation, time and quantity of menstrual discharge, protracted, continuing too long. That is what, once the period appears, the flow can go up to 30 days, 20 days, 30 days, 40 days. Menstruation, time and quantity of menstrual discharge, retarded, delaying. And also discharge suppressed. Amenorrhea, causes and concomitants, ovaries, diseases of. So these are the rubrics which we can consider from the uterine therapeutics by Henry Minton. Other remedies related to PCOD are affects the right side, Apis mellifica. We can think of Apis mellifica. Actually, Apis mellifica is also a very good remedy for treating ovary disorders of ovaries. It affects the right-sided ovary. There is enlargement or dropsy of right ovary. Congestion of head, other symptoms like congestion of head due to suppressed flow, thirstless and intolerant heat. This is very important in Apis. Hot patient, but thirstless. Very thirstless. Right-sided oophoritis with extreme soreness, together with burning or stinging sensation. In the ovarian cyst, it is an excellent remedy to control the growth, especially in the incipient stage with burning and stinging pains. Dysmenorrhea with severe ovarian pains, metrorrhagia profuse with heavy abdomen, faintness, stinging pains, sense of tightness, bearing down as if menses were to appear. Amenorrhea or menorrhagia with pain in the right ovary, better by lying on the right side. Enlargement of ovaries with pain in the pectoral region and cough. Apis has proved to be a curative remedy and has often cured tumors and has caused cystic formation to stop growing or to disappear. So that this is that cysts stop growing or they disappear when given Apis if the symptoms match. Pain worse from heat. We can also think of causticum. The main symptoms of causticum we know: intense sympathy for suffering of others, melancholic mood and sad and hopeless, involuntary urination while coughing, sneezing, blowing the nose, menses too early, too feeble, only during the day, seizures on lying down. This is very important symptom in causticum. Menses only during day. Menses cease almost entirely at night or continues for days. Pains are of gripping, cutting character and are relieved by double bending. Before menses, these colicky pains appear and associated with tearing pains in the back and limb. Menses delayed and late. Menses cease at night, flow only during the day. Leukorrhea at night with great weakness. See, I've compiled the materia medica from various authors like Borick, Clark, Kent, George Tulkas, and also Nash, and comparative materia medica by Farrington. These are the books which materia medica textbooks which I have referred. Lycopodium. Next, very good remedy for irregular menses or PCOD. We can think of Lycopodium. For persons intellectually keen but physically weak, upper part of the body emaciated, lower part semi-dropsical. Again, this also affects right side. Pain goes from right to left. Throat, chest, abdomen, liver, ovaries, in all the organs. Dryness of vagina, burning in, during and after coition. Physometra, that is discharge of flatus from the vagina. Discharge of blood from genitals during every stool. Menses too late, last too long, too profuse. Right ovarian pain. Varicose veins of pudenda. It is a great friend of women in inflammation and neuralgia of ovaries and inflammation of uterus. Neuralgia especially affects the right ovary. It has cured cystic tumors of right ovary. Absence or suppression of menses for many months. The patient being withered, declining, pale and sallow, becoming feeble. It seems that she has not the vitality to menstruate. Next remedy we can think of is lachesis. Lycopodium is right-sided, Apis mellifica is right-sided, lachesis is left-sided. Left side principally affected. Diseases begin on left, then go to right. Aggravation left ovary, testicle, chest, etc. Menses at regular times, too short, scanty, feeble. All pains relieved by flow. Always better during menses. Intolerance to tight bandage around the neck or waist. Jealousy and talkativeness. Increased sexual desire. Menstrual pains relieved by flow. Worse, pressure of clothes. Menses too short, too feeble. Left ovary very painful and indurated. Mammae inflamed, bluish. Acts especially well at the beginning and close of menstruation. See, we can think of menstruation in premenopausal women. It acts very well. Well-known aggravation of lachesis is after sleep. Lachesis symptoms are strong in women during menstruation because generally menstruation aggravates. There's a violent headache, boring pain in the vertex, nausea and vomiting during menses. The hemorrhage is black blood, pain in the left ovarian region or going left to right. Induration of ovaries. It has cured suppuration of ovaries. Uterine region is very sensitive to touch on the slightest contact of clothing. This is very characteristic in lachesis. Touch aggravates, even the touch of cloth. The general feature of lachesis to be relieved by discharges. That is why she is always better after menses. Next, we can think of pulsatilla. Weeps easily, thirstlessness. Derangement at puberty. Menses suppressed from getting feet wet. Menses too late, scanty, slimy, painful, irregular. Intermittent flow with evening chilliness. With intense pain and gracelessness. Tossing about, flow more during the day. It is like causticum. Delayed menses, cutting, pressing, with feeling of heaviness, converging towards the pudenda. Tearful, we all know pulsatilla mind. Tearful, mild, peevish, whimsical temperament, always crying. Amenorrhea by wetting the feet, and when nosebleed acts vicariously. This is like bryonia, vicarious menstruation for the menses. Too late and scanty menses. Amenorrhea, suppressed menses from getting feet wet, nervous debility or chlorosis, tardy menses, too late, scanty, thick, dark, clotted, changeable, intermittent menses with chilliness, nausea, and downward pressure. Menses painful, flow intermits. This is also seen clinically, intermittent flow. That is, patient says, I have flow for 2 days. It's only spotting. Again, one day there is no flow. From fourth day, again I will have heavy flow. We can think of pulsatilla. Flow intermits, diarrhea during or after menses. Other remedies that can be thought of are calcarea carb, nux vomica, sebina, tuja, platina, sulfur, nux moscata, phosphorus, etc. So conclusion. To conclude, what can we say? Polycystic ovarian disease is the initial stage of polycystic ovarian syndrome. Unhealthy lifestyle is one of the major causes. Homeopathic medicines help the patient to heal naturally. As I told earlier, it reduces the size of the cysts in the ovary by regularizing the cycles. Cycles become regular when the hormones are balanced. This is done naturally. That is why the stimulation required is very less. The medicines are energized by dynamization, which bring the delicate internal balance back to order. The principles on which homeopathic medicines are prescribed are based on natural laws. Therefore, homeopathic medicines are efficient in treating polycystic ovaries. Maintaining healthy lifestyle is also essential. From the above discussion, we can conclude that homeopathy medicines activate natural forces in the body and help in attaining health effectively. Can also conclude that PCOD can be treated with homeopathy medicine with assured results. And please don't forget to advise your PCOD patients with a good healthy diet. They have to follow a balanced diet, which balanced diet, wholesome meal, like which has 70% of carbohydrates, 60 to 70% of carbohydrates, 20 to 25% of proteins, and 2 to 3% of fat, and other 1 or 2% of micronutrients like vitamins and minerals, adequate amount of water, and also good sleep and exercise, physical activity. Increase physical activity at least 40 minutes a day, that is alternate days, which comes up to at least 2 hours per week. Which comes up to 2 hours per week. And also, it's better to advise on having small meals regularly at shorter intervals than fasting, because fasting causes more of insulin resistance, which is again a chain reaction. Fasting, insulin resistance, again the cycles become irregular. If the patient thinks that if she fasts she'll lose weight, that is foolishness. If she fasts, she is increasing her condition. So it's better, it is always advisable to have small meals with portion control at regular intervals of 2 or 3 hours, because there is gastric emptying once in 2.5 hours, and also insulin surge once in 2.5 hours. So when we keep on feeding once in 2.5 hours, that is healthy wholesome meal, not any junk, no what do you say, these juice or any other aerated drinks, no. Okay, healthy wholesome meals, and that too local produce is better. That is whatever is grown in their region. To advise, that is better. Local fruits, not exotic fruits, local vegetables, and also local food is advised in small quantities at shorter intervals of time. And also it's better to eat 2 hours before sleeping at night. That is, dinner should be finished within before 2 hours before sleeping. And it's advisable to take at least 150 to 200 steps after food, and also have good quality sleep, and stop the using of gadget at least half an hour before going to bed, because it will definitely affect the serotonin levels in the brain. So lifestyle management is very much important along with homeopathic medicines. Yes, of course, homeopathic medicines definitely will help in PCOD, but along with lifestyle management, good sleep, water, food, and less use of gadgets, along with homeopathic medicines, can do wonders, and it can give very good results, desirable results. Here, by saying all these, I conclude my presentation. Hope all of you had, what do you say? It was useful. It was useful for all of you. Thank you so much. Yes, sir.
Thank you, Dr. Deepthi Krishnamurty. And it's a very informative session. I'm sure a lot of participants will be here to interact with you.
Yes, sir. I'm ready for the Q&A session.
Yeah, we are having another 25 minutes
Yes, sir.
for us to interact.
Yes, sir.
Participants can go to the participant list and hand raise that I can unmute you. And PCOD is on epidemic proportions.
Yes, sir. It's on the raise, alarmingly raising these days.
Yeah.
Especially
every homeopathy is having a lot of cases, and lot of persons
definitely.
here will be here.
Yes, sir.
Ready to interact with you.
Yes, sir. Definitely.
And Dr. Hariharan is here.
Yes, sir. Hello, sir.
Okay. Okay, doctor, good evening. Very nice
Good
class.
evening, sir.
Very nice class. Very nice class.
Thank you, sir. Thank you so much.
See, I want to know, doctor, recently,
Yes, sir.
the teenage girls who are taking this chicken.
Yes.
Chicken is from.
Yes, sir. Yes,
chicken,
yes, of course.
See, chicken from this coming from farms. They are
Yes, sir.
using
Yes.
cortisone for their
Yes, sir.
immediate growth of the chicken, and that is causing one of the cause for this PCOD. I am noting here.
Yes, sir. Yes, 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 sir.
Next question: what are the laboratory tests have to be done for this PCOD? Then what is the importance of prolactin regarding say PCOD?
Yes, sir. Yes, sir. I'll answer that, sir. Laboratory investigations, I usually check for, first of all, I'll go for a complete hemogram, sir, because most of the times PCOD is sometimes related with anemia because of heavy flow for a prolonged interval. First is CBC. Second, it is sometimes it is also associated with other thyroid disorders, other endocrinal disorders like thyroid disorders and diabetes. So I check for thyroid profile, blood sugar, RBS in the beginning, CBC, thyroid profile, RBS, of course, an ultrasound abdomen and pelvis. And of course, as you in case of infertility, we have to check for prolactin, because prolactin causes inhibition of ovulation. That way, if prolactin is high, of course, there is some imbalance in the estrogen. So again, with proper treatment, prolactin can be reduced. These are the set of investigations I usually ask my patients to do, sir.
Okay. See, constitutional method is very good for this PCOD case. I think it's
yes, sir. Yes. With medicine, I insist on lifestyle management, sir.
Okay, very good, doctor.
Thank you.
Your conclusion is very nice. And see, the chicken is the chicken. I strictly avoid.
Yes, sir. Yes, sir. Of course, even I ask the patient to take any lean meat, not from chicken. I ask them to take fish if they want to take, because fish is a very good source of protein. I ask them to take fish if they are of mixed diet. Otherwise, I ask them to take protein with every meal. That is what is the main idea.
Okay, that is very important.
Yes, sir. Yes.
Thank you, Dr. Hariharan. And next is Dr. Sai Kiran.
Hello, sir. Good evening.
Good evening, ma'am.
Good evening, sir. Tell me, sir.
Ma'am, actually, I had a patient who is of 24 age, ma'am.
Yes,
so
sir.
she came to my OPD before 3 months. So last year LMP was on 17/6/2022, ma'am.
Okay, sir.
So the mainly impression was bilateral ovaries enlarged with multiple follicles, ma'am.
Yes, sir.
And the size of right ovary was 13 cc and left ovary was 23 cc, ma'am.
Okay, sir.
So after that, I have went into detailed case taken, and after that, I got some important symptoms. So for just she was not able to decide her mental symptoms, ma'am. So I was not able to get proper mental symptoms to find a constitutional remedy. So after
Okay,
that, I
sir.
have just for timing, I have prescribed a pulsatilla 1 mg, just
Okay,
2
sir.
doses, once in 15 days.
Okay, sir.
So next month she got menses, ma'am.
Okay, sir. Very good. Huh.
Okay, then I thought that okay, this is the effect of pulsatilla. Like if you are giving, that is a common remedy for PCOD. So I thought that okay, we will create a patient impression. Then after that, we'll try to dig out what is the constitution, and then we'll
Yes,
try
sir.
to go in the right way. Then after that,
Yes, sir.
I started with sulfur, ma'am. Like some symptoms, mentals, everything was matching. So I went with sulfur 200, ma'am.
Okay, sir.
Then after that, next month even the cycle was regular, and after that she got menses, ma'am. The
Okay,
main
sir.
thing is that after the second month, like after prescribing sulfur, till now she did not get menses, ma'am. So I was trying to change the remedy, but I don't know what was the exactly reason where I was lacking, ma'am. So I was trying to
Okay.
cover some mentals also, like physicals also, but like I don't know, from 2 to 3 months I was continuously changing medicines, ma'am. So I am going to like little bit I was going against the pathology. So like that I was trying to roll out, ma'am. So what was the exact reason where I was lacking? I don't know, ma'am. Can you help me out like in this case, ma'am?
Definitely, sir. If you ask my suggestion,
Yes,
I
ma'am.
think like after how many days after pulsatilla she got her menses, sir?
Approximately 1 month, 10 days, ma'am.
1 month, 10 days. So
Yes,
I
ma'am.
think you should have waited for pulsatilla to act. Of course,
Yes,
you
ma'am.
have to like you thought of constitutional remedy, sir. But
Okay, ma'am.
when like in my practice, I think when one remedy
ma'am.
is acting, it's better not for it's better for us to not interrupt the action of that remedy.
Yes, ma'am.
It's better we wait. We wait by after giving the dose, we wait. Maybe like generally what I do is after pulsatilla, anyhow she was getting regular menses.
Yes, ma'am.
Maybe you would have waited for her menses. We should have waited till when she gets regular menses.
Yes, ma'am.
Okay. So then
Yes,
if nothing was working out, again you would have repertorized and sir, and also I give one suggestion that you please follow the Boric's followable remedies, complementary
Yes,
and
ma'am.
followable remedies. That will
Yes,
help a
ma'am.
great deal.
Yes, ma'am.
Relationship of remedies are of great deal. You just check once if sulfur is not inimical to pulsatilla.
Yes, ma'am.
Okay, followable remedies are very important, sir. If at some point, if the book like if it is in the book that the previous remedy is inimical, the following remedy is inimical to previous remedy, definitely it will disturb the action of the previous remedy, which was good.
Yes, ma'am.
Okay, and in my practice, generally, I don't change the remedy or I don't repeat also. I don't
Okay,
repeat
ma'am.
until
Yes,
she
ma'am.
will not get her menses. That is, if it is, I'll also, yes, see, and one more, sir, if the lady is having menses once in 45 to 60 days, all of a sudden it will not become monthly. In my
Yes,
practice,
ma'am.
I've seen. First, it
Yes,
will
ma'am.
become 40 days, then 35 days, then 1 month. So
Yes, ma'am.
I give only minimum dose and try to wait
Yes, ma'am.
without hurrying, and
Yes, ma'am.
then go further with relationship of
Okay.
remedies.
Okay,
Thank
ma'am.
you, sir. Thank you very much. Hope it was
Okay.
helpful.
Yes, ma'am. Even I am from Gulbarga, ma'am.
Oh, very good, sir.
Okay, ma'am.
Nice meeting you here.
I know Krishnamurty sir very well, ma'am. But
Thank
I
you,
thought
sir.
that today it was really a great session, ma'am. Actually, the thing is that I was lacking. Why? Because like usually once I treated PCOD case just with Kali Carb, ma'am.
Yes, sir.
With 10 only single dose. In 2 months I got the result, but I don't know. In this case, like since 9th class she was having this complaint. So
Yes,
2-3
sir.
months I got satisfaction. After that, after 2 months, I don't know what homeopathy was exactly doing.
No, and actually, sir, one more thing. I also want to tell you that sometimes the female the lady will get menses regularly for 6 months. Then she may
Okay,
again
ma'am.
have irregular menses.
Yes, ma'am.
So
So the
it
thing
is
is that I
always,
should repertorize again, ma'am. Like I should
yes,
go to
yes,
case taking.
yes. Then we must take it as status quo. We have to repertorize again. or it's
Okay.
better to repeat the previous remedy with which you have got result.
Okay,
After
ma'am.
that, if you don't get result, it's better to retake the case. Maybe she's having some new symptoms. Repetize
ma'am.
that and then give that remedy.
Okay, ma'am. And even she is going on putting weight again, ma'am.
That is of course there, sir. And that is why I insist on exercise, physical activity and proper diet. That is very
Yes,
much
ma'am.
important, sir.
Okay, ma'am. Okay, ma'am.
We cannot expect, of course, remedy will help. But
Yes, ma'am.
for the remedy to help properly, the patient should be committed to have some
Yes,
physical
ma'am.
activity and diet.
Okay, ma'am. Thank you, ma'am.
Thank you, sir. Thank you so much, sir.
Thank you, Dr. Sai Kiran. And next is Dr. Hubert De Silva.
Hello, sir. Good evening.
Good evening, madam. It was a very nice presentation you have made. Madam, I have a case of a girl of 29. She
Yes,
is
sir.
96 kilograms.
Oh my God.
She having 11 months. She is already 11 months. She doesn't have periods.
Yes. Yes, sir.
She is very talkative, very talkative.
Yes,
She
sir.
is holding a very high position.
Yes, sir.
So these are the conditions, but I am I can't do anything because after taking some one medicine, sorry, I forgot that medicine, versicolor, Irish versicolor, she got 5 kilograms, she reduced to now
Yes,
her weight is 91 kilograms.
Yes, sir.
So the period is still, she doesn't want to be menstruated. That is one important thing. So can you say any guidance for me too?
Sir, actually, even in my patients I've seen, because what happens in PCOD cases, they will not get menses. But if they get menses, it is very troublesome. It will be prolonged for 15 days, 20 days, 25 days. And it is very irritating for a lady to be using the, sanitary pads for such a long time. It is very difficult. It irritates the skin and it causes a lot of problems. That is why some women, they don't want to get periods at all. It's okay, forget it, they'll say. But there is a side effect, adverse effect of not having proper periods. So maybe I think, sir, I suggest maybe you ask her, you take her case again, and of course again I insist on lifestyle, sir. She has to do some kind of physical activity, because PCOD responds very well for exercise and proper diet, sir. I have seen in my patients.
She's also hypothyroid.
Yes, that is there, sir. I told you.
High.
Yes, I told you. You can check for her insulin also. You can check for her RBS and insulin. Definitely they'll be high. Because if she is 91 at the age of 29, what is her height, sir?
She's maybe 6.6.
Oh, okay, 5.6 up to 6.
5.6. 5.6. Sorry.
5.6. Okay, that is what she is obese only for her height, age. If you check her RBS, definitely she'll be having high RBS, and if you check her insulin, definitely it will be high. That is what happens in PCOD, sir. There is insulin resistance. It is not that insulin is not there, but insulin is not being utilized by the cells. So insulin gets utilized by the cells only when there is physical activity. So it's better you advise her. This is the only way, sir. As I have seen in my practice, there is no shortcut at all. Proper eating, proper exercise, physical. That is why I told at least 2 hours a week is sufficient. 2 hours of exercise a week, not continuously also. 40-minute sessions, alternate days. That is not very difficult. So 2 hours a week with good protein intake, proper diet, lifestyle management, good sleep. That is very important. Actually, these days, sir, earlier they used to say, my grandparents and all used to say, if you don't eat well, if you don't sleep well, you lose weight. But now it is opposite. If you don't eat well, if you don't sleep well, you'll gain weight. Because of PCOD.
Thank you, madam. Thank you.
Thank you, sir. Thank you. Hope it was helpful, sir.
Any medicines you can suggest?
If it is so prolonged, we can think of pulsatilla, sir. Is it from her menarche?
Pardon?
Is it from when she started menstruating, from her puberty, from her menarche?
Yeah, it may be. It may be. Yeah.
Then maybe you can think of pulsatilla, sir, because pulsatilla is only remedy which says irregular menses since menarche, since puberty. It is the only remedy.
Which
So-
potency you suggest?
I usually use LM potency, sir, 0/1.
Thank you, madam. Thank you.
Okay, sir. Thank you, sir. Thank you so much.
Thank you, Dr. Hubert. And by this class, it's being pointed out that we are having a lot of obstacles to cure, and it is lack of exercise and irregular diet. Everything should be considered by a homeopath for the right selection of medicine. And there are a sea of medicines, I think. By doctor's session itself, we can understand that. And the selection point is the generals.
Yes,
And
yes, yes,
we
sir.
shouldn't follow some medicines for some therapeutically designed medicines for so and so complaints
No,
and all. And she's
no.
insisting that. And
Yes, definitely, sir.
we can see that a doctor is using single medicines, least minimum dose, and she's not repeating that.
Yes,
And that too in LM potency. That's great. And we are having Dr. Samina.
Hello,
in the-
ma'am. Good evening.
Good evening, ma'am. It was a very nice session. So
Thank you
actually,
very much.
I'll just a short case. It's a long case, but a query, because when she came to me, she had came for backache with extreme pain and pain radiating to the legs. So I gave her took an entire history, and she was fine. I gave her lac equinum because she had a lot of anger, anticipation, and lot of issues, mentally stressed and all that, and she was better with. And of course I took her other history, so she was said I have this irregular menses. And so now what is the thing, I then for the menses now especially I am giving, I increase the potency. Maybe she didn't get a period. Last she got was in April, so now it's 2 months, and before that she got every 1 month, and then again 6 months, like irregular, 6 months back she didn't have. So like that, so I gave her, since it had helped lac equinum, I repeated, then I went higher also, but she did not get her period. So I didn't know the relation, so I gave her folliculinum. She cannot tolerate domination and very good as a sarcode. So and DD I'm giving now twice now since 1 week. So how to go about in such, and your experience of using folliculinum, ufurinum, and for how long I can give, since the first remedy had helped lac equinum. So yeah.
Actually, ma'am, to be frank with you, I have never used folliculinum, ufurinum in my PCOD cases. It's very rare. I've till now I have not used it. So I don't have any experience using that.
Okay.
So maybe after folliculinum, what happened?
No, it's now since 1 week.
Oh.
She messaged me that she is having that sensation as if, like how she
Okay.
gets in menses, but that is
Okay.
just today I got a message from her. So
Okay.
I just told her to take for 1 week this folliculinum. So like today it will get over. And
Then it's better to wait for next 15 days.
okay.
And
So no,
meanwhile,
I'll
you get a
keep her on
scan.
placebo. Yeah.
And I also suggest ultrasound abdomen every 3 months.
Yeah. Now she got it. Last week only I told her, that time the cyst,
Okay.
yeah, it showed.
And also keep a record of the size of the ovaries in that is in cc, in the ml.
Okay.
Size of the ovaries. It should be reducing. Only then there is result. And again, exercise, diet is very important.
Yes. And her schedule is so hectic, I don't know she's finding time for exercise.
Ma'am, I humbly tell you that whatever patient does is for their sake.
Yeah.
We have to educate them. See, you are not doing anything for anybody else's sake.
Yes.
You are doing it for yourself, not for somebody else.
Hmm.
And only then they get motivated.
Yes.
because this is a very long-standing disease, and patient cannot think medicine should do everything. That is not possible, because
Yes.
how much ever medicine tries to correct, again there is long lifestyle, again there is wrong eating habits. How much can a medicine do?
Yes.
So you have to tell the patient, see, they have to make time for themselves. Of course, everybody is busy. Nobody is just free, just like that. No, of course
Yes.
they are busy. If they are making time, it is there for their health. It is for their well-being. Not even for the doctor, not even for the family members, not about for somebody else. It is for themselves. If they realize this, definitely they'll do.
Okay.
Hope it was helpful, ma'am. Thank you.
Yeah. So I think I'll wait and maybe I can review the case again, because like,
Yes, yes,
I see
yes.
the other, the
Yes.
other animal, like
Yes.
Lacus was also coming. Yeah.
Yes, yes, ma'am. And always please repertorize, and don't only stand on repertory. Always cross-check with Materia Medica.
Thank you, Doctor.
Thank you,
And
sir.
next we are having Dr. Shaila with us. Dr. Shaila.
Hello, ma'am. Good evening.
Madam, good evening. Your class is very nice and very
Thank you.
helpful.
Thank you, ma'am. Thank you so much.
Your voice and speech are very clear.
Thank you, ma'am. Thank you so much.
My doubt is that in prolactin increases cases, the management is same or any other specific medicines or acute medicines for that?
No, ma'am. I generally don't use any specific medicines. I repertorize the case, cross-check with Materia Medica, and only then prescribe. I generally don't use specifics, ma'am. Practicing this way has given me good results. Actually, here I what do you say? Wish to tell one more case. One of my patients, she is married for 8 years now. She
Yes,
has
ma'am.
PCOD. She has PCOD from her menarche. That is from almost 18 years. She's 36 now. Okay. On and off, almost 20 years she has this problem. And from last 18 years, she's taking hormones. I was horrified.
Yes,
That is,
yes, ma'am.
if she takes hormones, only then she'll get periods.
Okay.
Her health was so bad. Her body, mind, everything was so. She had lost hopes about leaving because she is childless. Okay. Even in such cases, this approach has helped me. Now, with she never had periods without hormones for 18 years.
Yes.
Now with treatment, she is having periods once in 45 days, 50 days, but naturally without hormones.
Okay.
So now she has got a hope, and of course, she is very, very obedient. She will follow the proper diet, whatever may occur. She'll follow the diet. She'll do physical activity. She'll drink lot of water. She'll follow whatever I say. She's very obedient, and she is getting very good results.
Okay, madam. Thank you.
Thank you, ma'am. Thank you so much. It was helpful. Hope it was helpful.
Thank you, Doctor. And next is Dr. Kumar.
Hello, sir. Good evening.
Doctor?
Very good evening, ma'am.
Good evening, sir.
Am I audible? Yeah,
Yes,
good
sir.
evening.
You are. Yes, sir. You are.
I have two questions. The first one
Yes,
is,
sir.
how much time do you wait in case of long standing cases of amenorrhea? After you prescribe a simillimum, how
Okay.
long you have to wait?
Generally, first when I prescribe, I wait for a week, sir.
So okay.
See, for example, she has not had her period for 2 months, 3 months. I wait for a week.
Okay.
In
Then,
case she does not get, I will wait only for a month.
okay.
Maximum 1 month. Then I'll refer to a gynecologist. I am very frank with this, because in such stubborn cases where the pathology is too much, and they are also not helping the doctor by not following the advice. This is a practical point, sir. If they don't follow our advice properly, they'll not get proper results. That is for sure.
Okay, ma'am. So you mean
If
that
yes, sir. If they take proper medicine and follow proper advice, definitely they'll get menses within 15-20 days. That is for sure. But
Okay,
in
ma'am.
very stubborn cases like what I told just now, she will not have menses without tablets. In her case, I waited for 4 months because she was fed up of taking tablets. She has taken it for 18 years. She was fed up and she never wanted to go for hormones again. She said by her will, she waited for 4 months.
Wonderful, ma'am. And
Thank you, sir.
so in case in 1 week it is not responding, it means our simulum is strong or the potency is not right.
Yes, of course. But
wonderful.
if we also ask for any other symptoms, say for example, premenstrual symptoms, maybe white discharge or pain abdomen, sensitive breasts. See, we are cross-check with all these.
Okay, ma'am.
And also I prefer water dose, sir.
Oh, so LM potencies in water doses.
Yes, water dose. That is we call jumping potency.
Yes, ma'am. So
Yes.
wonderful, ma'am. And
Thank
my
you, sir.
second doubt is that there is a recent trends going on that
Yes,
the
sir.
lunar cycles coinciding with the menstrual cycle, like that some courses and all are going on. So
Yes, sir.
have you seen it coinciding exactly the same way? Or are homeopathic remedies bringing up in the same cycle in the same way? Is there any idea that way?
No, I have, first of all, to be frank, I have not heard of this. Cycles coinciding with lunar cycles. I have not heard of this till now, sir. Maybe I'm not aware of it. Secondly, what I want to tell you is, I always tell my patients also, each periods for women, each woman is different. First of all, a woman A may have different pattern of periods. Woman B will have different pattern of periods, and also for the same woman, for the same lady, each period is different. Nature is always, it is not uniform. It can never be I mean to say it can be same, but at least it varies. Each period for the same lady is different. Each pregnancy for the same lady is different. So I cannot comment on this, sir. I don't believe that it will coincide with lunar cycles. Maybe I'm not aware of it. I'll what do you say? Educate myself about this more.
Thank you, Dr. Kumar. And
Thank you, sir. Thank you so much.
I think it's time to conclude our session. And we are very happy to have Dr. Deepthi with us. And
thank you, sir. Thank you so much.
She is sure a beacon of hope for homeopathy.
Thank you, sir.
We are a lot of persons, I think, are drifting from the cardinals of homeopathy. So whatever the disease name is, we need to be in line, stick to the fundamentals of homeopathy. That's what doctor is imparting us. And I thank Dr. Deepthi on behalf of IFPH for the session, and I welcome her again for our session to come back again and again. Thank you, doctor. And it's time. Yeah, please.
I thank this platform very immensely for giving me a second chance. And definitely, I would love to come back again with more gynecological cases. And I would definitely, I'm looking forward for more meetings like this. It was a very great experience. The questions asked by the doctors, it is really enlightening, even for me. I will go back and learn so many things. I'm very thankful, sir. I'm very grateful to IFPH. Thank you once again. Good night.
Thank you. Thank you all. And it's time to start the Malayalam session. Over to Dr. Hubert De Silva.